thing about learning is that no one can take it away from you. It's a quote from a famous person. Welcome to AHS Guide, your learning companion for anatomy, physiology, biochemistry, pathology, and microbiology. Here, we simplify the complex concepts with clear explanations and visual diagrams and the exam focused tips so that you can learn smarter and build a strong medical foundation. In today's class, we'll begin exploring the cardiovascular system, the transport highway of our body. Our focus will be on the three key areas: the blood supply to the heart. So you'll be able to understand the coronary circulation, including the right and the left coronary arteries, their branches, and the venous drainage. Systemic circulation, the pathway that delivers the oxygen-rich blood from the heart to the entire body and returns the deoxygenated blood back to heart. The pulmonary circulation, the specialized circuit where a deoxygenated blood travels to the lungs, exchanges the gases, and returns the oxygenated blood to the heart. So by the end of the session, you'll clearly see how these circulatory routes and rules work together to sustain the life and maintain the homeostasis in the human body. So as I told, we will be starting with the first subtopic under cardiovascular system for today, which is blood supply of heart. Previously, I've covered the heart size, location, position, chambers of heart. The video will be put in the link as well. You can go check the previous video from cardiovascular system. So it is essential to understand the structure of heart, external and the internal structures of the heart in order to learn the blood supply of heart as well. Now the blood supply of heart, firstly the artery supply, we'll see the artery supply and we'll see the venous drainage of the heart. So when heart is trying to pump the blood to the whole body, which type of blood vascular system is going to help and provide oxygen and receive the carbon dioxide for the heart itself? So there should be some type of supply to the heart as well when it is trying to do the work of the whole body, right? So this is called the blood supply of heart because the supply of the oxygenated and deoxygenated blood to the heart itself is going to be studied here. Now the first part is the arterial supply. Here it is called as coronary circulation because it is a heart related circulation. Coronary is a heart related circulation and it is a central important topic for the circulation that is happening in the heart. The heart receives approximately 5% of the cardiac output via the coronary arteries. So whenever the heart is trying to pump the oxygenated blood, it also receives its own supply, its own share of supply, which is approximately around 5% among the 95% and 100% that is being pumped out to the other parts of your body. So 5% is the amount of oxygenated blood or the cardiac output that is received via coronary arteries. Now the blood supply to the myocardium occurs mainly during diastole. So the blood supply to the heart, the muscles receive oxygenated blood when the heart is at relaxed state or at the diastolic phase. So the diastole and the systole will be learned in the physiology, which I'll be uploading in future. So till then, keep watching this AHS guide. So you first understand the anatomy of heart, then we'll start with the physiology of the heart. Moving on, the main arteries that are involved in the coronary circulation. The first one is the right coronary artery, which is also called RCA in short form. Now the RCA originates from the right aortic sinus of the ascending aorta and runs in the right atrioventricular sulcus and supplies the right atrium, most of the right ventricle, the diaphragmatic part of the left ventricle, the SA node, AV node and posterior 1/3 of interventricular septum. So remembering all these points are important in order to understand how the blood supply of the oxygenated blood supply of the heart is. Now, firstly, the right coronary artery, as you can see, there is a aortic arch. So this is the ascending aorta. The beginning of the aorta is called ascending aorta. Here, the right coronary starts at the base of the right aortic ascending aorta, and it moves to the and runs to the right atrioventricular sulcus. So there is right atrium here and right ventricle down here. So it moves in the groove, the connection between the right atria and ventricle. There is a sulcus, there is a depression over there. So that in that depression, the right coronary artery runs through it, and it starts winding around the heart and supplying oxygenated blood to the muscles of the heart. Now, where all the RCA is supplying the oxygenated blood? To the right atrium, and most of the right ventricle is supplied by the right coronary artery. Now, the diaphragmatic part of left ventricle is also being supplied with the oxygenated blood. There is SA node as well, sinoatrial node, the AV node, atrioventricular node. These two are involved in the pacemaking process, that is in the process of pumping the blood, and it is involved in the mechanism of pumping of blood. So SA node and AV node will be learned in the physiology as well. Now the posterior 1/3 of the interventricular septum as well is being supplied by the RCA in the right dominant circulation. So basically the RCA, as it says, it covers the most part of right portion of the heart. So it is the right dominant circulation is going to happen over here. And as you can see, there are various other we'll see the left main coronary artery later. Just focus on the right coronary artery. You can see it starts from the aorta, ascending aorta, then moves through the atrioventricular sulcus, then to the right ventricle. It supplies the right atrium as well as right ventricle, and it also moves to the posterior, that is behind the heart. You can see that there is a lightened part of the RCA, wherein it supplies the interventricular septum as well. So the right posterior branch and the posterior descending artery that you see are providing blood supply to the posterior region of the interventricular septum. So it is like 1/3 portion of the interventricular septum is being supplied by the right coronary artery. Now moving on, we have left coronary artery, which runs to the left side of the heart and is supplying the oxygenated blood to the left region of the heart. Now where does it arise? It again arises from the left aortic sinuses. So it is again from right side. You see from the right region, the ascending aortic sinuses, ascending aorta is being giving the two different arteries, which is right coronary artery and the left coronary artery. This left coronary artery is rising from the left aortic sinuses. So it is an opening in the aorta that is going to arise and branch out as left coronary artery. This has a very short trunk that quickly divides into two major branches, which is left anterior descending artery and left circumflex artery. So you can see by the name only you can identify left anterior descending artery, meaning the left there are two branches for left coronary artery. The two main branches, in that the first branch that you can see here is the left anterior, which is going in the anterior portion of the heart and is descending. It is moving downwards. So it is a left anterior descending artery. It can also be known as anterior interventricular artery because it moves on the interventricular septum. Now there is another branch of left coronary artery, which is left circumflex artery. So by the name only you can understand it is going to circle the heart. So it is what? Left circumflex artery. Now what is the role of LAD? How is it traveling? So it travels in the anterior interventricular sulcus and it supplies the anterior wall of left ventricle and anterior two-thirds of the interventricular septum. So the anterior portion of interventricular septum is covered by LAD, and the anterior wall of left ventricle is being supplied, the oxygenated blood is being supplied by the LAD, which is left anterior descending artery. Now the circumflex artery, so we'll see how the left anterior descending arteries. You can see a septal branch, a diagonal branch as well, and it is moving on the interventricular septum, anterior portion of the interventricular septum, and is providing two-thirds of blood supply to the anterior interventricular septum. Now there is the LAD also is supplying blood to the apex, that is the tip of the heart as well, apex of the heart, and the part of right ventricle, and the bundle branches of the conduction system also. The bundle branches, which include bundle of His, which is involved in the pumping of blood. The nervous system that is involved in the pumping of blood is being, the blood supply is being given by the left and anterior descending artery. Now the left circumflex artery, here it courses through the left anterior ventricular groove. So right coronary artery moves to the right atrioventricular groove. Here left circumflex artery moves to the left atrioventricular groove. And the blood supply received by LCX is left atrium. So obviously it's moving in the atrioventricular groove, and you can see which all structures are present in that region, which is left atrium, lateral and posterior walls of left ventricle, and the sinoatrial node. 40% of people, for them it is like the SA node is being supplied with LCX artery, and sometimes the posterior ventricular septum as well in the left dominant circulation. So these are the blood supply regions for the LAD and LCX. Now the second type of artery that is being supplying the blood, we have seen the coronary arterial coronary supply. Now we'll see the dominance of how much blood is being given. Now coronary artery dominance determined by which the coronary artery gives rise to posterior descending artery, that is PDA, and right dominant circulation has approximately around 70%. So the posterior descending artery from the right coronary artery. The left dominant circulation has the posterior descending artery from the left circumflex artery. Then we have a co-dominant circulation. Here the posterior descending artery from both right coronary artery and left circumflex artery. So what is this coronary dominance? So you can determine how much percentage of coronary artery is being arising from the posterior region, posterior descending artery. Now here the posterior descending artery is a branch of a branch. Here you can see there is a posterior descending artery which is moving from the right posterior branch. So here the right dominant circulation by PDA is approximately around 70% of right dominant circulation is handled by this posterior descending artery. Then we have 10 to 15% of left dominant circulation handled by the posterior dominant descending artery, and a co-dominant circulation which is handled by right coronary artery and left coronary circumflex is approximately 15 to 20%. So it is the percentage of how much blood is being circulated on the different regions of the heart. So since the heart is in cone shaped, it has the blood supply on right side, left side, as well as both the circulations that is happening at one region, which is co-dominant circulation. Now the venous drainage, which involves the whatever deoxygenate the carbon dioxide that is released by the heart muscles, that is being taken up by the blood supply, that is venous veins of the heart. Now venous drainage of heart, venous drainage from myocardium is collected primarily by the coronary sinus and other smaller veins. We have seen aortic sinus. Here it is different. It is a coronary sinus wherein the heart pours out all the deoxygenated blood into the veins. So that is the role of a coronary sinus here. Here there are very smaller veins that collect the blood, deoxygenated blood, and pump it to the major veins. So the major veins that are here involved in the venous drainage are coronary sinus. So it is the main vein of the heart and drains into the right atrium, and it is located in the posterior anterior groove. It receives the from the great cardiac vein, the middle cardiac vein, and the small cardiac vein. It also receives from the oblique vein of the left atrium as well. So we'll see what are the structures in coronary sinus. So you can see the coronary sinus here. It is opening into the right atrium. So all the deoxygenated blood is pushed into the right atrium. From right atrium it goes to the right ventricle, and from right ventricle it goes into the pulmonary trunk, wherein it is going to be pumped to the lungs, wherein lungs do the exchange of gases and allow the oxygenated blood to enter into the left atrium. So this is how the veins are going to drain out all deoxygenated blood from the muscles of the heart into the right atrium. Remember, the place where all deoxygenated blood is getting collected is at right atrium. It is this coronary sinus is located in the posterior atrioventricular groove. Posterior region, atrioventricular, that is atrium and ventricular depression, that groove, that is where the coronary sinus is seen. So from where all is coronary sinus receiving blood? It is receiving the deoxygenated blood from the great cardiac vein, which is here, you can see in the anterior region. Then it receives from the middle cardiac vein as well. Here is the middle cardiac vein that is running posteriorly. Then we have small cardiac vein which is running medially, and oblique vein of left atrium, which is not represented here, but it is running in the parallel region that you can see here. Yeah. So those are the different veins that are going to drain out all deoxygenated blood into the coronary sinus, which is the major vein. Now the another major vein that you can see is a great cardiac vein. It accompanies the, it is running close to the left anterior descending artery, and it drains the anterior portion of the heart. So whatever anterior region of the heart, the deoxygenated blood is collected in the great cardiac vein. And the middle cardiac vein is accompanied by the posterior descending artery, and this is running along PDA. Here the posterior interventricular region is going to drain out all the deoxygenated blood into the middle cardiac vein. Now the small cardiac vein is running close to the right coronary artery, and here the right atrium and the right ventricle are going to drain all the deoxygenated blood into it. The anterior cardiac vein, it drains directly into the right atrium, and there is no requirement of coronary sinus because it runs exactly on the anterior region and above the right atrium. Now the Thebesian vein, which is vena cordis minima, are the tiny veins that drain directly into the heart chambers, especially the right and the right ventricle and the right atrium. So these right atrium and ventricle, since they receive all the deoxygenated blood, small veins that are present are going to drain directly into these heart chambers, that is right atrium and right ventricle. There is no requirement of them going into the coronary sinus and coming back again into the right atrium. Since they are on the right atrium and ventricle, these veins directly drain into it. So here is an image of how an oblique vein is on the left atrium. And here is the image of a right anterior cardiac vein. And there are small cardiac vein as well, oblique vein, we have already seen that, and the coronary sinus, which is ghosted. And ghosted in the sense it is it is not seen, it is posteriorly present. Here you can see in the posterior region, and you can see where it is getting drained. It is all the blood is being collected from posterior region into the coronary sinus and then drained into the right atrium. There is a small into the final topic of today, which is the clinical relevance of the blood supply of heart. So we understood the anatomy of how the blood supply is to the heart, and now here we will be studying about what in all terms related to the clinicals of the anatomy that we have studied is going to be put here. So there are 4 important diseases that you have to note that can be caused because of the any obstruction or any problems in the blood supply to the heart. So firstly, which is myocardial infarction. Myocardial infarction is one such disease which is caused due to the occlusion or blockage of the arteries. Like there are 3 major arteries that can be blocked, and that leads to the cause of myocardial infarction. The left anterior descending artery, then we have right coronary artery and left circumflex artery. So if in case there is any blockage due to the cholesterol or the any blockage in the artery due to any other diseases like the obesity or diabetes or any other diseases, there can be blockage in the blood supply of heart, and especially in these 3 arteries it can cause myocardial infarction leading to low supply of oxygen and the death of the muscle tissue, the cardiac muscle tissue, and it leads to myocardial infarction, which is cardiac arrest. Angina pectoris is another type of disease wherein there is a transient ischemia due to the reduced coronary blood flow. Whenever the blood flow to the heart is reduced, there is not much oxygen being supplied to the heart, and there is accumulation of carbon dioxide leading to the death of the cardiac muscle tissue or the cells. This is called a transient ischemia, and once there is a transient ischemia, angina pectoris occurs and the patient is going to go into cardiac arrest. A coronary artery bypass graft is a surgical procedure wherein a graft from your internal thoracic artery or a saphenous vein which is taken from the leg is going to be taken as a graft or a blood supply, blood vessel that is going to be replaced in the place of where the blood supply to the heart is being occluded or surgically removed due to any other causes. So the infected blood vessel or the defected blood vessel is surgically removed and another graft is taken from either internal thoracic artery or from the saphenous vein in the leg. So these are taken as graft and replaced at the defected artery region. So that is called coronary artery bypass graft, and it is seen in most of the patients undergoing surgeries related to the cardiac related issues like atherosclerosis or any other disease that is causing the blockade in the artery. So CABG is usually done to the patient infected with the blockage in the blood supply. Now coronary angiography is a diagnostic test. Here the imaging is used to visualize the coronary artery blockages. So you can see a live image of wherever the blockage is in the heart. So this coronary angiography is conducted before the CABG is done, and this is a diagnostic procedure wherein to analyze any blockage and precisely where the blockage is. The anatomy of where the blockage is can be seen through the coronary angiography. So this covers the topic on blood supply of heart. So we have learned about the artery supply, the venous drainage or the coronary sinuses, and we have also learned about the clinical relevance about these arteries and veins as well. So in the next video we'll be studying about the systemic and pulmonary circulation. So till then, keep watching AHS Guide, subscribe to the channel to understand the much more complex topics into simpler versions that I have put into PPT. The notes shall be provided in the description. You can go through the description, find out the notes and download it. You can study the notes as well. And the revision will be done once the topic is completed. Till then, keep watching AHS Guide. Thank you.